Okay. Thank you, Talina, because I would have forgot.
I know.
So, I guess she said, first of all, let's introduce each other. So you've already kind of heard from Talina and I. We are with the Lifespan Respite Grant. We have the 3-year and the 5-year Lifespan Respite grants right now. And we work closely with Stephanie Redo that's on here. We subcontract with her to do our respite voucher program and to do sib shops and other things. But yeah, we're from Oklahoma, and we have the Oklahoma Caregiver Coalition that's running big and wild and all kinds of things. We just had one of our meetings today, so we're all kind of trying to catch our breath from that, but it was fabulous. So anyway, Cheryl, you want to introduce yourself?
Hi, my name is Cheryl Donnell. I'm the Executive Director for the Nevada Lifespan Respite Care Coalition. Our state has also received several of the Lifespan Respite grants, finishing up 3rd year of one of our Lifespan grants. So we got the 5-year grant and a 3-year grant, another 3-year grant. So we've got several various pieces of Lifespan Respite program grants going. At the same time, we're also part of the pilot program for the Lifespan or the Respite worker training program, the pilot.
Okay. Marilyn?
Thank you, Nadine. My camera's broken, so I can't turn it on. I'm Marilyn Sword, and I coordinate the Idaho Caregiver Alliance, which is our respite coalition. And we are, this is our 3rd 3-year Lifespan Respite grant, and it will end in August of 2023. So we as a coalition, because we're not going to pursue, our Commission on Aging is not going to pursue another application, we are looking for a home and a way we can continue the work we are doing.
Okay. I'm sorry to hear that, Marilyn.
Yeah, me too.
That would be, I think you discussed that. I've been on other meetings with you, and
Yeah,
kind of breaks my heart to hear that. Okay. I'm going to mess up y'all's names. Would one of you just introduce yourself?
I'll go. Good afternoon, everyone. My name is Yetunde Olobatuyi, and I am representing Maryland Department of Human Services. We recently received the respite grants in 2020. The position has been vacant, so I just came on board a few months ago. I want to say 4 months ago. So we are starting brand new into using the new respite grant from the ACL. So I am pretty much new, and I just look forward into learning from every one of you.
Great. Miss Delaware. Maybe she had to step away. Stephanie and Talina, is there anything more you want to introduce yourselves? Okay. All right. Okay. So you guys saw that there were 3 areas that we could talk about. And does anybody have a strong opinion on which one we do? We start with the stakeholder involvement. That talks about just being involved with other partners and their involvement and buy-in on your programs. Marketing and outreach is the second topic, or a topic. It doesn't have to be the second one. And then another topic is offering information and assistance. Does anybody have any desire to talk about one over the other?
This is Cheryl. I am concerned when states are not participating in Lifespan Respite, but one of the challenges is getting that buy-in with other players in the states, to go after funding like Lifespan Respite grants. But just that whole idea of changing their system because we get siloed, we get, we do it this way, you can't do it that way because we do it this way kind of attitudes. And so I know we ran a voucher, respite voucher program for a couple of years under our last lifespan respite grant. And now we're as a coalition are trying to expand availability of respite services. And one of the issues is that we're losing providers in our state. They can't staff their organizations, so they're closing their doors and so everyone loses their respite or has to find another provider. So that's one level, just that network level, getting participation in respite. And then the other level is the state agencies and data collection and having everybody work on, they all have representative groups, constituencies that they're trying to serve, but they're not willing to look at the overlaps or the gaps very well. And so if anyone has any ideas about stakeholder engagement in respite, we've kind of been feeling that we may need to go from the big organizations that are kind of all that's left in our network to going into a process of how are we supporting new entries, new people who maybe only have one client they want to serve, but they want to be a respite, agency, a respite provider in our system, and see what's the smallest provider and get many small providers up and running. And then they can meet some of this unmet need. So I don't know if anyone's had any thoughts about that, but that's kind of what we're looking at in Nevada.
Cheryl, I just want to make some clarification for some that are newer here. So respite programs can have different provider types. It sounds like, Cheryl, you are dependent, or the way you run your respite voucher program is through agencies, that the providers
many of them are.
have to be an agency. In Oklahoma, we don't have agencies necessarily. We do more, the family caregiver chooses that individuals. We're hands off. We don't have anybody that we recommend. We don't want to be involved in any liability issues. So for those of you that are new, or just for clarification, every respite voucher program runs a little bit differently. We all want to provide respite, but there's a little bit of twist and everything. Stephanie, you run ours. Anything to add to that?
I think one thing that we've really worked on lately is out of the box thinking. And like Nadine said, our caregivers are allowed to pick their respite provider. And so we have caregivers that use dance studios, therapeutic riding, gymnastics. So we're trying to find more providers like that and encourage caregivers to think out of the box. There may not be a family member that could watch the child, but there may be a program or after school tutoring or something that can still allow the parent to have a break. So I think just that's what we're really focusing on right now is more out of the box thinking and getting parents to do that as well.
And again, that's their choice. We just make recommendations.
Right.
We don't touch it. If they want to get a neighbor, if they want to get another family member, we also allow family members that live within the home, as long as they're 18 and over and they are not the primary caregiver. So
yeah, those people are easy to serve if they can identify their own provider. It's those that don't have a provider and all the agencies aren't taking new clients. So who do they go to? Gosh, thank you for the funding. What can I do with it? And so that idea of where do they turn? We've been, of course, we're participating in the respite worker training program to build hopefully some new respite providers, but the idea of having the funding get to them. So through whatever process, sometimes it's a little intimidating. So even a small provider needs some support. Even if they're, I just want to be a respite provider. Well, how do I get matched up? How do I get found? How do I get my name on the list somewhere? How are you promoting me if I'm say I would like to help in respite? So some of those issues are some of the ones that we're kind of grappling with.
Yeah, I want to just tell you that, and I want to get to the hand up. I see that hand. We were in that pilot also, Oklahoma was, and our leadership made us pull out because of the liability issues. So again, I know some of the struggles, that others, Marilyn, that you're having, sometimes leadership doesn't have the same vision as we may have, but we've tried to get, those a provider registry type list. I've wanted it forever, and we just we got told no, you're not going there because of the liability issues. So disheartening, but Cheryl, I understand what you're saying. Your hand's up. Did you want to ask a question?
Yes, I just want to ask, how many hours do you provide your clients? Do you have a certain hours that you give them that they have to spend, or do you just allow them to figure it out themselves?
You guys just want to go around the room? Cheryl, you want to start, and then Marilyn and Stephanie want to answer it? We can't hear you, Cheryl.
Forget about whether I'm muted or not. They have funded budget, so they have either certain amount of dollars that they can spend, or they have usually that's in our voucher programs. That's how it's handled. So they start out with a budget of anywhere in the ranges from like $125 up to $300, and then they get a certain time frame to spend that in. So that could be monthly, every 3 months, whatever. And then they have to find a provider that will accept the voucher, or because we don't do a lot of family paid respite. We do have some, but mostly they have to be a provider in the system to receive the funding. So we've got different mechanisms for them to receive funding, either through a fiscal intermediary or as a state vendor of services, like some of the agencies, bigger agencies are. And then what the rate of pay is. So if a provider is charging $25 an hour, then that means for $125, that's 4 hours, that they get or 5 hours that they get to spend during the course of a month, because that gets eaten up really quickly. If they had 300, then it might be that they could get a lot for a short period of time, and then they might run out. So I think that's a question that each program has kind of grappled with, is how they are going to, what level of funding they're going to provide, and what that actually is going to be able to purchase in the amount of hours of respite. So I hope that helps. That's what we've done.
Marilyn, would you like to add to that?
Sure, Nadine. Our Idaho Commission on Aging is the agency that funds to our area agency on aging. We have 6 of them, and they provide consumer directed services. It started with respite, and now it's branching out to other consumer directed services. So it's much like what Nadine described, as the family chooses who they want to provide respite, what kind of respite they want is what's most appropriate for the person they're caring for. And they can have up to $600 every 6 months, and they can spend it kind of all at once, or they can spend it out over the course of the 6 months, and it can be back to back 6 months. So it could be up to $1,200 a year. They can use it to buy a gas card for somebody, if the person is taking the person to community events, that sort of thing. It's very flexible. And I think we had the same liability issues, Nadine. So this is very much in the in the lap of the family for them to choose what kind of respite, who, and when. And they can often, the $600 may not be adequate. The family may be supplementing that, but that's what's available. And they make application through our area agencies on aging.
Good. Stephanie, you want to add to that?
In Oklahoma, our families get $400 every 4 months for the first child, $200 for each eligible additional child or care receiver. I'm sorry, it can be a care receiver, up to $800 max in a 4-month time period. It can only be used for respite. They have to fill out the voucher with that respite provider. And I go through, and if they don't use their voucher 1 month or their money 1 month or one cycle, at Sooner Success, we have county coordinators all over the state. So I connect their county coordinator with them to try to find out what's the barrier of them not using their respite. You know, if they aren't finding a provider, if they don't know how it works, things like that. And so the county coordinator can kind of work with them. Like Nadine said, you know, we don't make recommendations of a provider, but we can make sure they know, you know, they have options. It doesn't have to be, you know, a traditional babysitter. There's lots of options out there for the families.
Good. Hi, Abby. You want to
Hi,
introduce
I'm
yourself?
sorry,
real
I
quick?
was late.
That's
I had
okay.
a meeting from 1 to 2. But I'm Abby Daraponsany. I work at the New York State Office for the Aging.
Hi, welcome. We had a question. I think it kind of originated with how much you want to restate your question. I forgot because we've gone through different things.
Yes, I asked a question. How many hours or how much do you give each families? And thank you to you three that have answered. Thank you so much for that.
So in New York, our Caregiving and Respite Coalition, they offer vouchers, and they offer a $600 voucher that can be used, has to be used within 6 months of the year, and they can apply twice in a year. So they can get up to $1,200 annually, but they have to use it within the first first $600 within the first 6 months to be able to apply for another.
Thank you.
Okay. That stakeholder involvement topic also included some of the prompting questions was like, who are some of your essential stakeholders in your voucher program? Cheryl, you want to?
And the essential stakeholders,
that.
we used our no wrong door system and the no wrong door navigators that were helping anyone who was calling for assistance would use what we call caregiver protocols to identify when they were talking to a caregiver, so that the individual didn't have to self-identify and ask for respite, but that they could at least start a conversation about that that caregiver's needs for support and for respite. And as a result of that discussion, they were either referred to one of the existing respite programs. We have kind of a split in our state of for seniors, if they are dementia-oriented conditions, then they go to Alzheimer's Association. If they're non-dementia, everything, but they're 60 and older, then they go to our couple of providers, Senior in Service and Helping Hands of Vegas Valley. And then if they are younger than that, then good luck. There might be a provider in your area. Maybe they can qualify for DD, Regional Center services for respite. Maybe they can qualify for, if they have children, for a respite program that has both state and federal funding, or state and local and funding. And then our program, our voucher, was a gap program, and it filled in who couldn't find a service provider who couldn't, who was not being served under those parameters for whatever reason. And it might have been that there was both an adult with disabilities and a child with disabilities, and they could be served by the same program. So a GAP program was to kind of remove some of those barriers to why aren't they getting respite. And they selected their own provider. So that could be a family, friend, neighbor, individual, or it could be an agency provider who they felt comfortable using. So, and then they negotiated the rate in our program as what they would pay that individual. But our state's kind of come down and said, you need to pay $15 minimum. That's kind of where we are. And so even though that was the average on our respite pilot program, now it's got to be the bare minimum. And most of our service agencies are in 30, they're up there now. They're $28, $30 an hour. So they're almost double what that minimum wage requirement is. So I don't know if that helps.
Okay, Marilyn?
I just had a couple of questions. One for Nevada in terms of, do you use your lifespan respite funds to provide respite or respite vouchers to families of children? And then my second question is, and to Nevada or anybody, do you utilize your local independent living centers? Because in Idaho, those centers have personal care or attendant services that they can refer people to, and that could provide respite. And I didn't know if anybody interacted with your independent living centers. So thanks, Nadine.
Marilyn, this is Cheryl. In Nevada, our lifespan respite grant is lifespan. So birth to death. And then as far as a partner with the independent living, we have an independent living council. So we do some work at the state level with the independent living council. They do not in our state run PCA agencies. They may make referrals to agencies, but they don't fund or have quite maybe a bigger delivery or service role in respite in our state. So I don't know, might be a comparison of what the different states are doing with their independent living centers. Ours does a lot of transportation, advocacy training, and food stability, a whole bunch of those kind of things. So not so much respite.
Thanks.
Stephanie, you want to talk about what the SILs do here? I can if you're not comfortable.
I'm not familiar with that as much. So if you would talk about that, that'd be great.
No, I think I'm lagging a little bit. I'm on a hot spot for some reason. I apologize. Maybe if I turn my camera off, it'd be better. But if it gets bad, tell me and I'll turn my camera off. Unfortunately, the SILs, the Center for Independent Livings in Oklahoma, have not been good partners with us. There's been some history long before any of us in Oklahoma were there, and we just can't get them on board. We have tried to offer various services to get them on our coalition. We know they need us. I don't think they just know how bad they need us, but we are Lifespan too. We're that GAP program like Cheryl talked about. Anybody, Stephanie screens them. And one of the things that I feel like, I'll let Stephanie talk more about this, but I think one of our biggest advantages in Oklahoma is the respite voucher programs that we have. We are a committee and we talk quarterly. All the respite voucher programs, 7, 8, 9 of us, however many can join when they do. Everybody knows what each other does. So a referral is made quickly, easily. We're all on board with each other. And they know that Stephanie, if they can't support them, Stephanie's probably going to get the call. It may not be the right referral because she knows for sure that we can't supplant. We can't supplant those other programs. So Stephanie, anything else you want to add to that?
Yes, I mean, we have the respite subcommittee, and it has been wonderful. We have an online referral system. And even just this week, I put in a referral yesterday and I've gotten 2 emails. It's went through 2 different respite programs, just finding the right one. And it's an interesting case with interesting caregiver, but it's amazing to see each program putting their documentation on it and getting it to the next program so that we can get that caregiver where they need to be, which is our ultimate goal.
Right.
And like I mentioned earlier, we have Sooner Success County coordinators across the state who are knowledgeable about the respite programs. And so if a caregiver calls a county coordinator, they're able to help get them connected to the program as well.
What Stephanie's talking about, we developed a kind of a survey format with all the respite voucher programs on there. When they get a call, they refer it on this app, like they refer it to the agency they think it needs to go to and why they can't serve them. So it just kind of breaks down the information and for the next provider that we think it needs to go to. Sometimes we don't always hit it, like Stephanie's talking about, but we finally get it without the caregiver having to navigate that system. We navigate it for them and we get them through that process. And then again, it brings all of our providers. I mean, Stephanie knows them all by first name. She can call them. She knows their phone number. And we put that together just again, so that we do the work for the caregiver. So Stephanie does a great job on that. I
And
see
it
we've
gives
got,
us the documentation that we need.
yes,
to
yes, because
show.
again, we're real sticklers here in Oklahoma. We can't supplant. You've got to prove to us, you got to tell us why can you not support that caregiver? And if they don't give us the right documentation until that happens, Stephanie has hands off. We need that documentation. We're not going to supplant another program. Yuta, you want to introduce yourself and then ask your question?
Yeah. Hello, this is Yuta from the Arizona Caregiver Coalition. We sort of came in a little bit on the tail end, but I heard that last question. So I just wanted to state that, so Arizona too, yes, we do support children. We have identified one particular gap group, and that's through our DDD program, the developmental disabilities, where roughly 10% of the families that they serve are not eligible for the state Medicaid program. And so they just get a support coordinator, as it's called here in Arizona, but no services. And so the Division of Developmental Disabilities actually actively refers families to the Lifespan Respite program if they are not Medicaid eligible. And then the comment on the Centers for Independent Living, it's really interesting. We one of our board members is from the largest Center of Independent Living in Arizona, so we actually have pretty good relationship there and connections. But the general feedback we get from the Centers of Independent Living is that their primary focus is on independence. They're not into the caregiver, situation. They have no problem with supporting caregivers, and if they know of any, they would send them to us, but they really focus on the person with the disability being independent. And so they sometimes seem to feel that there's not a real connection for them to the respite program.
Good point. That makes me feel better a little bit from what's going on in Oklahoma. But yeah, thank you. Thank you. Abby, did you want to share anything on that topic on this?
So in New York, we have 6 regional independent living centers that function as our Aging and Disability Resource Center, which in New York is New York Connects. So they're housed at our 59 area agencies on aging and then 6 of the independent living centers. And so as part of our Lifespan Respite grant, we are going to implement the life course tools for respite with our New York Connects coordinators. And we're going to be training them on that over the next coming years, how to use the life course tools for respite. So I think, it'll give the ILCs an understanding of the needs of caregivers and, that there are services out there that they can refer them to, especially the voucher program through our Caregiving and Respite Coalition.
Mm-hmm. Good. All right. Does would you like to present anything or ask any questions of us? Maybe we're overwhelming her.
This is Cheryl. While we've got room for just some new discussion, maybe on the third topic of offering information and assistance, I represent a coalition. It serves in an advisory capacity to our Aging and Disability Services Division. And so it has more of a role in state strategic planning, policy, legislative recommendations, etc. And so the idea of what a coalition would be offering, so I don't know if there's too many differences here in this group about how the coalition interacts with the lifespan respite vouchers. But I was wondering what you saw the role of your state's coalition in, and how do they interact, or how do they help with your lifespan respite voucher?
Selena, you want to answer that for Oklahoma, or you want me to do it? You want me to? Okay. The Lifespan Respite Grant is the one that started our coalition years ago, and took the role. We have 180 some partners on the coalition. It's more of a partnership. It's not membership based. It's just the more the merrier that can come. I think we had maybe 45 on our virtual coalition meeting today, which is fine. Again, we just want people to feel very open to come to attend. It's more of resources. We try to figure out what resources are out there. We were really promoting, for example, today, our caregiver conference, which is November 1st, which you can go to okcares.org and join us. It's a virtual conference. We have 380 some registered now, but please come. It'd be, you know, a great way to see kind of what some of the things the coalition's doing, and a way to do a virtual conference if you're interested in doing that. But Cheryl, to answer your question, the coalition is supported by Lifespan Respite. I mean, if Lifespan Respite goes away, I think we'll be okay. But again, and we don't usually funding for the coalition because we are at the Department of Human Services, a big state agency. We can probably support it even if the Lifespan Respite funding is exhausted or we don't get any additional funding. But it's more of just it's just so great to see all these different caregivers and care providers come together and hear each other and hear the resources. We let everybody introduce each other. We keep it very short and sweet, but the connections that are being made, and we have each one of the coalition partners, they have to be on a subcommittee. That's the only requirement we ask. You're on a subcommittee, you're on a respite subcommittee, transportation, you get a pick, maybe legal, all these different, we have I think there's 9 now subcommittees, I could be wrong, but that's the only commitment we have. And we just ask that they be signed up on that. And what that does is help us, Selena, our team. If someone calls and has a transportation issue, I have 30 or 40 people on a subcommittee I can go to and say, help. I need help on this, on those really difficult topics that we have. Respite's one, it's probably our most active subcommittee. But again, the Lifespan Respite started that coalition. We could sustain it if Lifespan Respite was gone, but we hope it's never gone. But I hope that answers your question. Cheryl, is that where you were wanting to know? Marilyn, what's your take on that, Ben?
Our coalition also, like Nadine, was started with Lifespan Respite, our first Lifespan Respite grant. And we have an annual conference that the coalition, that our alliance does. Ours is going to be March 11th, by the way. We also have worked during the legislative session, which is the first 3 months of the year. We have an intern who's a student at Boise State work with me and monitor the activities that are going on in the legislature that impact caregivers. And then he or she does a weekly update of those things, and it goes out to our email list, which is about 1,500. So, and then we have quarterly meetings. Any of those 1,500 people can come. Typically in our quarterly meetings, we have 75 to 115 members all on Zoom. And then so the conference, the legislative work, we're doing a legislative luncheon again this year on Valentine's Day. We haven't done one since the pandemic. So it's exciting because we're going to have a huge turnover in our legislature. So it's an opportunity for caregivers to meet their legislators and for legislators to learn more about lifespan respite and family caregiving. And we have a quarterly email newsletter that goes out. We don't act necessarily in an advisory capacity to our Idaho Commission on Aging, that is the recipient of the Lifespan Respite Grant, but we work together. We get out information about respite providers, about what I meet quarterly with the organization that represents all of our AAA directors in the state. So but we also we're doing a presentation tomorrow to our State Independent Living Council. And we are working right now on a project with our local independent living center to get the word out about the shortage of direct care and the shortage of the direct care workforce, and what we can do to raise awareness, elevate the work, and connect direct care workers with one another. That's just in one corner of the state. So we're not in a position where, at least right now, we don't know how we will be sustained without the Lifespan Respite Grant. Our Commission on Aging received a big chunk of state money to continue their support for caregivers, but that's being pushed out through the AAAs. It doesn't involve us. So, but we see without the Lifespan Respite Grant, there's all those folks under 60 or under 55 or 65 that are still going to need what we do. We've also been piloting a navigator project where any caregiver across the lifespan can call in and talk to a navigator, interview-based assessment. We're using T-Care right now, and Abby knows that because we've had a lot of conversations with New York. And then a care plan is developed for the caregiver, not for the care recipient, but for the caregiver. And then we check in with them periodically. So that's been and that's funded by Medicaid, and their money follows the person funds. So we've done that for about 2.5 years. So that kind of gives you an idea of what the alliance or the coalition does in Idaho.
Marilyn, money follows the person funds what? What part of that you were talking about?
Money Follows the Person in Idaho is a project of Medicaid, but it funds our Family Caregiver Navigator project.
Navigator,
it sees that project as postponing placement in a facility.
I like it. Okay. Anybody else? It looks like we're going to get cut off. Does anybody else want to say something real quick that's innovative and something we haven't mentioned? Okay. All right. So which one of you going to be the spokesperson? I will. But jump in. Please jump in if there's something that I don't touch on that you think we should. And like she said, reach out. If Oklahoma can help any of you in any way, we're happy to talk and visit, and we'll reach out to you. Marilyn, I'm really interested in that navigator. How you work. Money Follows the Person. I've worked with them in other grants. I have several grants, and I've worked with them in another one. I just never thought of that twist. I like it.
Well, give me a call, Nadine, and we can talk about it.
Okay, sounds good.
Marilyn, this is Jutta. So since your program is Medicaid funded, do they refer the Medicaid members to that program to you?
Anybody can call It could be a self-referral, a provider referral. Anyone can call, and they don't have to be on Medicaid. The caregiver doesn't have to be, and the care recipient does not have to be.
Yeah, that makes sense. I just wonder if Medicaid refers, because we have this just thick wall between Medicaid and everything else, right? They
Yeah,
cannot tell us who is on Medicaid, and that's where a lot of the caregivers are.
We track where the caregivers come from to a certain degree. I don't know that Medicaid is a big referral.
Yeah.
Mostly it's our area agencies on aging.
Okay. Any other questions or comments or something? It's again, something that you're doing different than what hasn't been mentioned. I know
We're
we're
about
working-
2.5 minutes, it looks like.
Okay. I know we're getting ready to do our strategic plan in Oklahoma. We haven't done that in a few years, so we keep it pretty, we get our key partners together and we try to do a 1 day because everybody's so busy. Strategic planning. I'm hoping to do
Nadine,
that
did
after the
you-
first of the year.
Do you have some format that you're following?
Oh,
Go ahead, Selena.
no, I was just gonna remind you that you were gonna use some of the HOPE model.
Yeah, I don't know if you know about the Hope Centered based, I've just lost it. It's the Hope focus on that Oklahoma is very centered on being hope minded. Hope Center, I can't think of the training. If you look up Hope training,
Hope Rising?
you'll know what it is.
Hope
What is it?
training?
HOPE
Rising.
Rising with Dr. Chan. Can you not hear me? Is she frozen now?
I
Yeah,
can hear
she
you, but I
is.
think she's frozen.
Yeah, okay, great. So yeah, there she is. She's back.
Dr. Chan, there you go. No, again, Dr. Chan, the hope training, and we're going to base it on that. And basically it's that everybody has hope. They just need to break down the barriers. And if we can help them break those barriers down, what are those? Determine, get that person to realize what that barrier is. So our strategic plan is will be based around that this year. A little different twist maybe, but again, it gets down to the root of what we're trying to accomplish for family caregivers. They need to realize what their barriers are, and we need to figure out how we can help them overcome those barriers. So, all right. Well, I guess they're going to call us. I'm sorry. I don't know why I'm having to use my hotspot today of all days, but I am. Technology. Well, it's a pleasure meeting all of you. And again, like I said, feel free to reach out to our team in Oklahoma. We're always happy to help. We had to ask a lot of questions years and years ago when we started with the Lifespan Respite program. So we might have something to offer. All right.
All right.
Gonna call-
I'm gonna close the room now.
Okay. Thanks, Talina.